Welcome, everyone. We're just going to give everyone a few minutes. We've still got people logging in. It's great to have so many people watching tonight. We'll see when the numbers start to slow down here and we'll get started. Hopefully, wherever you are, the weather is not too bad. I'm hearing stories about snowstorms. Robin, let me know when you think that we're mostly got everyone in attendance.
Sure. Let me just have a look.
Oh, numbers are still going up.
Yeah.
This is fantastic. So happy to have
to
everybody here online with us.
I think you can go ahead. We have
Okay.
132, which is great from across Canada, so that's very exciting.
Fantastic. Well, welcome everybody. I'm Suzanne Schlechte, the Project Engagement Officer from the Canadian Child Care Federation, and I'm really happy to be here with my colleague Robin McMillan, and you're more used to seeing her face than mine, but she's letting me take the reins tonight for a little while. I'm also happy to be here with Erica Phipps, Helen Doyle, and Lynn Soramecki. And we're so happy to be bringing this professional development opportunity right to you. For the duration of the webinar, you're going to find that you're muted. But please feel free to use the chat or the question functions on your screen. At the end of the presentation, we're going to have time for questions and comments. And note that the professional development certificates will be sent within a week of the webinar. We know you want your certificates and we'll get them to you, but give us a little bit of time, give us a week and we'll get those out. If you haven't received it in a week, then send us an email and check on it. And I would like to give you the land acknowledgement. We respectfully acknowledge that the land on which the CCCF is located is the traditional unceded territory of the Algonquin and Anishinaabe people. We recognize all Indigenous people who were here before us, those who live with us now, and the 7 generations to come. As Indigenous people have done since time immemorial, we strive to be responsible stewards of the land and to respect the cultures, ceremonies, and traditions of all who call it home. As we open our hearts and minds to the past, we commit ourselves to be working in a spirit of truth and reconciliation to make a better future for all. Today, these lands continue to be shared territory and are occupied by many diverse peoples from near and far. A treaty is an inheritance, a responsibility, and a relationship. We acknowledge the harms and mistakes of the past and dedicate ourselves to move forward in partnership with Indigenous communities in a spirit of reconciliation and collaboration. And now over to you, Erica and Lynn.
Thank you, Suzanne, and thank you, Robin and CCCF for welcoming us to this webinar tonight. And hello, everyone. We're delighted to have so many people here today. So my name is Erica Phipps, and I'm Executive Director of the Canadian Partnership for Children's Health and Environment. And I'm really excited to share some of our work with you this evening. Starting by getting the slides right. Okay. So in recent years, there's been increasing interest and concern about toxic chemicals and pollution and what it all means for our health. These are just a few examples of news coverage of topics such as the so-called forever chemicals, the PFAS chemicals that are used in nonstick cookware and plastics and stain repellent clothing, etc. Microplastics turning up in our drinking water and our food, levels of lead in our drinking water, the relationship between exposure to polluted air and children's ability to learn, and also positive elements of how environments such as access to green space can help in early childhood development. So perhaps you've been coming across some of this in your day-to-day life, and perhaps some of these questions have come up in discussion with the families of the children in your care. So it's against this backdrop that we're really excited to share this webinar this evening. We're going to dig into some of these issues, starting with some of the reasons that babies and children are more vulnerable to harm from toxic chemicals. We'll share some tips for action and explore the unique opportunity of home-based childcare providers to create healthier home environments for yourself and your family, while at the same time creating healthier early learning settings for the children in your care. We'll spend some time talking about some simple actions that you can take related to plastics, toxic chemicals, and dust, food choices that can reduce harmful exposures, and tips related to child-healthy renovations. We'll introduce you to some CPCHE resources where you can learn more about these and other ways to create healthier home and early learning environments for children. And as Suzanne mentioned, we'll have plenty of time at the end for questions and discussions. So the resources that we're going to be sharing with you tonight have been produced through a longstanding collaboration between CPCHE and the Canadian Child Care Federation. So a few words about CPCHE. We are a collaborative partnership of some 20 organizations from across Canada, including CCCF, that have come together with a shared goal of ensuring that all children in Canada have healthy environments in which to live, learn, play, and grow. For more than 20 years, CPCHE partners have been distilling key messages from the growing body of scientific evidence of how toxic chemicals can harm children in order to help frontline professionals, including childcare professionals, with practical knowledge that can be built into day-to-day interactions with families and children. So this webinar is an example of that collaborative work. We're really thrilled to be working with our colleagues at CCCF, and I'm equally delighted to be here this evening with Lynn Soramaki with the Thunder Bay District Health Unit, a CPCHE affiliate organization, as well as Helen Doyle with the Ontario Public Health Association, a CPCHE partner organization. Lynn and Helen both bring a wealth of expertise and practical knowledge from a public health perspective, and look forward to engaging with you on questions that you may have. So over the next 30 minutes, we'll share some tips on low-cost, simple actions that you can take to make your home-based childcare spaces healthier and more environmentally sustainable. Along the way, we'll also share some knowledge about why it's especially important to protect young children from toxic chemicals and other hazards. And across all this, the bonus is that taking some of these steps will also mean a healthier home environment for yourself and as a family. And it can be a great way to model some best practices for client families. During this session, you'll become familiar with how to access the CPCHE childcare checklist, as well as our CPCHE top 5 tips for creating healthier home environments for children. So our aim is to share actions that are accessible, low cost, and practical. We hope you'll feel inspired to take one or several of the toxics reducing tips you'll learn about this evening, or simply make a commitment to learn more. Our homes are central to our lives. They're the place where we rest and recharge, enjoy meals together, and raise our families. In the case of home-based childcare professionals, all of you, they're also an important early learning setting for other children in your communities. At the same time that our homes are central to our well-being, they can also be a place where we come into contact with harmful chemicals that come from day-to-day products, building materials, and furnishings. So we're really delighted to have a focus this evening in this webinar on the really important role that home-based childcare professionals can play in creating healthy home and learning environments for children in Canada. So thank you for the work that you do. CPCHE has long recognized the importance of healthy home environments for giving kids the best possible start on lifelong health. Our popular top 5 tips offer some simple, practical ways to do that in the home. So you're seeing here some images of our brochure, the tip cards, and a video that are available in multiple languages on our website. And I'm going to, in a moment, show you a brief clip from the CPCHE Top 5 Tips video, which helps to explain why exactly is it that children are more vulnerable to the harm from exposure to toxic chemicals and pollution. And it gives a little window into what you can expect from some of the top 5 tips resources that may be of interest to you. So we'll see if this video will start for us.
Every parent wants the best for their children. We use car seats, put up safety gates, teach our children to cross the street safely, and plan for their education. We do this because we want to keep our kids safe and ensure that they reach their full potential. But did you know that there are other ways to help our children onto a path towards lifelong health? During the next few minutes, we're going to share with you some simple, low-cost tips on ways to protect your kids from health risks you might not have heard much about and usually cannot see. Toxic substances in the home. Whether you are planning to start a family, are expecting a baby, or already have children, these tips can help you create a healthier home environment for you and your family. Low levels of toxic substances are common in our environment, both outside and indoors. Harmful chemicals that stick to dust, fumes from household cleaners and renovation products, chemicals in plastics, and mercury in fish, all of these can have harmful effects on the growing brains and bodies of babies and children. Compared to adults, babies and children take in more toxic substances from their environment because they eat more, drink more, and breathe more for their size. Also, sticky fingers and toys can carry toxic substances that have settled into dust into curious mouths. Development starts in the womb and continues through childhood. The brain, immune system, digestive system, lungs, liver, and kidneys are still being formed as the baby grows up. Because all of these systems are not fully developed, babies and children are at a greater risk from toxic substances. Let's look at the brain, for example. Exposure to toxic chemicals while the brain is being built can harm how the brain is formed and how it functions. This interruption can have lifelong effects on behavior and the ability to learn.
So the other sort of context that I wanted to share with you before we get into some of the practical information are some highlights from a national survey that CPCHE and the CCCF with researchers at the University of Ottawa conducted in 2022. Over 2,000 childcare professionals responded to the survey, sharing their experience and views on indoor air quality, reducing toxic exposures, climate change, greener play spaces, and more. About a quarter of the participants in the survey worked in home-based care. The findings reveal that childcare professionals are concerned about a range of issues. Overall, about 2/3 of respondents were somewhat or very concerned about toxic chemicals in products, 69%, outdoor air pollution, a similar level, children lacking connection with nature, also 69%, climate change, 68%, contaminants in food and in water, 65%, poor indoor air quality, 64%, hazardous chemicals in cleaning, sanitizing, and disinfecting products, and plastics such as BPA and microplastics also of concern for the respondents to the survey. Survey responses also suggest, however, that the childcare sector is ready to be proactive and engaged on these types of issues. Half of the respondents felt that the childcare sector definitely has a role to play in reducing children's exposures to toxic chemicals and pollution. And more than 4 out of 5 felt that it was very or somewhat important for childcare programs to strive to be ecologically sustainable or green. The findings also reveal that childcare professionals are observing unhealthy conditions in the spaces where they work. So for example, about a third were reporting peeling paint on walls, woodwork, or other surfaces, which may pose a lead hazard. 22% reported having lead in their water service lines. Only about 20% had reported that their program had been tested for radon gas, which is the second leading cause of lung cancer in Canada following cigarette smoking. 42% reported that testing hadn't been done, and more than a third were unsure. 1 in 5 reporting pesticides used indoor on a routine basis. About a third noticing fumes or air pollution. More than a third reported being affected by wildfire smoke in the past 2 years. And 22%, or about 1 in 5, reported that there was a moldy smell or mold in the childcare program where they were working. Respondents also told us about some of the practices that they're undertaking that, probably unknown to them, can actually increase toxic chemical exposure, such as using quote unquote air fresheners or putting artificial turf indoors, as well as practices that can decrease harmful exposures, such as avoiding the use of antibacterial soap and ensuring a fragrance-free environment. About 2/3 said that their client families definitely or somewhat support action on environmental health and sustainability in childcare settings. So that's also encouraging to see that level of support from families as well. So I'm going to pass it over to my colleague Lynn, who's going to share some of the practical tips that come both from the top 5 tips as well as from our childcare checklist resource that we'll get into a little bit later. Over to you, Lynn.
So hi there. Thanks, everyone. Nice to be here this evening. And like Erica mentioned before, I am with the Thunder Bay District Health Unit. And if anybody who's been in Thunder Bay, you know that there are no skyscrapers in Thunder Bay. We have a beautiful sleeping giant on Lake Superior. I am in Toronto tonight, and I thought I'd share the skyscrapers behind me with all of you because I'm in downtown Toronto, which doesn't happen too often. So that's kind of cool to be here. Anyways, so we'll get started. Get drastic with plastic. So one of the tips in the top 5 tips is get drastic with plastic. And it provides great ideas on simple things that you could do to reduce children's exposure to the chemicals in plastic. Many of these same tips are echoed in the Child Care Resource Hub and checklist. So plastics are useful, but they can also be a source of health risk. Most plastics are made from fossil fuels, also known as petroleum. And plastics production, use, and waste are associated with numerous challenges, including unsustainable resource use, greenhouse gas emissions, and pollution. Plastics also break down over time into microplastics, which can be found just about everywhere in lakes and rivers, in the ocean, in the soil, in the food supply, and then even in our bodies. So chemicals are added to plastics to give them certain qualities, such as to make them soft or hard, or to give them color or fire resistance. And some of these chemicals are known or suspected to harm human health and or the environment. So some of the things that you can do in terms of tips with get drastics with plastic, you can choose safer plastics, which includes avoiding plastics with recycling symbols 3, 6, and 7. Replacing vinyl PVC toys with safer options. So one of the things you want to look for is that says PVC free or phthalate free. You want to avoid those with vinyl or PVC on a label. The biggest thing that I find that you could probably identify that there may be PVC is toys or plastic items that have a strong chemical smell. If you've ever opened a pack of vinyl shower curtains, you know what I'm talking about. It's like a really, really strong smell. You want to avoid other items made of vinyl, such as bibs, tablecloths, and shower curtains. And referring back to the survey that Erica was talking about, there was additional findings that were related to plastics included. More than half of survey respondents reported that children in their program play with toys made of PVC, and 43% reported the use of vinyl-covered sleeping mats or cots or mattresses, and 22% reported that their program used sleeping mats, mattresses made of polyurethane foam. So again, get drastic with plastics, especially when you're heating and serving foods and drink. You should avoid microwaving in plastics, even if the label says microwave safe. Containers are tested for melting point and not for whether chemicals are leaching into those plastics. So even really good microwave safe plastic containers may not be the greatest as well. So avoid altogether microwaving plastics. Allow food drinks to cool before transferring to plastic serving containers. And you want to opt for fresh or frozen instead of canned foods to reduce exposure to BPA. One of the survey's questions, the results it was included related to plastics. The respondents indicated, there was 45% of respondents indicated that staff in their program heat food or drinks or put hot food or drinks into plastic containers. And I have a story. I was at a health fair at a school one time, and there was a teacher. We had a display on recycling plastics and not microwaving plastics, and she was actually using all of her margarine containers and her sour cream containers. She was reusing them to heat the kids' lunches in the microwave. And so we just had a bit of a conversation around it may be good for the environment that you're reusing all the containers and you're recycling them, but it's not really good for our health to be using them in that manner. So you have to find that balance where it's also have to be good for your health as well too. In terms of food choices, so healthy food choices can help reduce exposures to toxic chemicals. And so you want to choose fish that's low in mercury, such as rainbow trout, tilapia, salmon. If serving canned tuna, you want to choose light instead of white, because light tuna has less mercury. So when you're looking at maybe in terms of making some changes, that's actually a really easy change to make. You want to just look for light instead of white. And if you fish in local waters, you may want to check your fish advisories to make sure it's safe to eat. And you can ask your public health department about that. If you go, a lot of times those manuals are from the Ministry of the Environment, and they usually in the spring they have them out at the beer stores, those kinds of places, or you can go online and find that as well. You want also avoid foods in grease-resistant packaging, like what you use for microwaving popcorn, and choose organic when possible. The survey results also included that 1/3, so 34% of respondents reported that their childcare program serves locally grown or organic foods or grows some of its own food. And growing some foods on site can be a low-cost way to bring organics into your program while creating a great hands-on learning activity for kids. You may want to, though, if you decide to do that, check with public health to see if your soil might first need to be tested for lead and other contaminants. If you don't have suitable outdoor space for gardening, maybe you want to consider some container gardening, sorry. And another one of our tips is bust that dust. And kids love that term, so it's kind of cute. A lot of times they'll like to say that, bust that dust. So some of the things that you can, or why is there a concern in terms of the house dust? Ordinary house dust contains small amounts of toxic chemicals, much of which comes from products such as plastics, furniture, electronics. Dust may also contain lead from old paint, common in older buildings. Contaminants tracked in from outdoors can also end up in dust, and chemicals found in dust can harm children's health. So some of the things that you can do, again, there's some really simple things that you can do in terms of busting that dust. You want to frequently damp mop or vacuum floors. And you want to routinely remove dust from surfaces with a damp cloth. And it's really important that you use a damp cloth, because if you dry dust, like it says in the video, when you're going to watch it later on, you'll see that it just, sends all the dust back in the air. So a damp cloth is very important. Dispose of vacuum bags safely, especially the contents of the vacuum. You should never be composted. And that also goes for dryer lint. You should never compost dryer lint. And also opt for hard surface flooring, which is easier to keep clean than carpeting or textured surfaces. The survey, again, showed that 26% reported wall-to-wall or extensive carpeting in their childcare centers, and 23% reported they had indoor artificial turf. So one of the biggest things that you can do to bust that dust is to actually leave your shoes at the door. Try and avoid not walking around in your home with shoes that are full of mud and those sorts of things, because that really is a really good prevention tip. You want to also choose less toxic furnishings and products. For example, you want to use liquid gel and paste art materials rather than powders and sprays. You want to replace items made of foam, especially if ripped or deteriorating, and avoid using pesticides in and around your home. And I'll just talk about the fragrance on the next slide. So fragrances, there's some fragrance chemicals that may be harmful, particularly to children and to individuals who are sensitive to them. And fragrances may trigger itchy or watery eyes, worsening or asthma symptoms and other breathing problems. It can give people headaches or other types of effects. Some chemicals used in fragrance can also contribute to long-term health effects. So for example, phthalates, a type of chemical used to make a scent last longer, might interfere with your body's hormone and have been linked to harm to child health and development. So some of the things that you can do that, again, are easy to do are avoiding products that with the word fragrance or parfum in the list of ingredients. And when you're looking at the list of ingredients, it's like reading a food label. So if you're looking at a food label and the first ingredients is water or green beans or whatever, that's what's the most in that label. And so same thing with a label with fragrances or shampoos or those sorts of things. The ingredients that's highest has the most in it. And you'll see whether there's fragrance or parfum in that list. It's usually, somewhere in the bottom or a little bit higher up. And also don't use air fresheners or scented candles. And a candle's a candle, so regardless of what type, it's still scented. Choose fragrance-free laundry detergent. Avoid scented fabric softeners or dryer sheets. Use simple toxic-free alternatives, like it's using baking soda, vinegar instead of strong-smelling cleaning products for routine household cleaning, like things like Mr. Clean, those sorts of stronger chemicals. You could use baking soda and vinegar instead. Avoid buying scented toys or arts and craft supplies, scented markers. One story too, another reason I mentioned that in one of the webinars with regards to the air fresheners, and particularly the ones that are the plug-in ones. Have you ever seen air fresheners that you plug into the wall and they have the little gel packs that you put in them? And that's concerning in terms of when we do injury prevention at our health unit with accidental poisonings, because we've heard of cases, one in particular, where a child went behind a couch. The couch had wheels. The child was able to push the couch out of the way, grab the air freshener, grab the gel pack, and ingested it. And so obviously they had to call poison control, that sorts of thing. But it's just another reason not to have those things around the home. Next slide. Yep. So another tip is our renovate right. And so strong fumes and toxic chemicals and dust during and after renovations can put kids at risk. And so things, again, that you can do is choosing less toxic paints, finishes, and glues. So what you want to look for on the labels of paint cans is you want to look for VOC free, zero VOC, or low VOC. You want to open windows and use fans to bring in fresh air. Very important. Control and contain all your dust. Again, that's extremely important. Seal off the rest of the house with plastic sheeting and close heating and cooling vents. You want to avoid sanding, scraping, or burning old paint, especially in homes built before 1978. And children and pregnant persons should stay away from areas being renovated until all fumes are gone and all dust has been cleaned up. What's important to note is that paints used in older homes likely contain lead, and it can harm the developing brain. You could cover old painted surfaces with new paint instead of sanding or scraping. But again, another thing is if you have paint chips, around your windowsill, you want to make sure that those are not somewhere in reach where kids can chew those, because a lot of times lead is sweet to taste. And so if a child starts chewing on that, they may want to keep chewing on it. So again, it's really concerning there. So you want to make sure that you don't have any paint chips anywhere. And then dampness or mold is another thing, and you want to check out the CPCHE Rent Safe resources to learn more about that. One of the common myths and truths about mold, the myth is that one myth includes you can clean mold with bleach, and so that's wrong. And so fact is bleach will not help to clean your mold. You should use soap and water. You should wear gloves and proper mask if cleaning mold. Never clean mold yourself if you're having health problems from the mold or if you have a breathing problem like asthma. And you want to get information for public health on how to clean mold properly and safely. Myth number 2, only certain kinds of colors of molds are dangerous. And again, that's, like I said, a myth. All forms of mold growth in the home may pose a health hazard and can cause long-term health effects with ongoing exposure. Your third myth, you can cover up mold with mold-blocking paint. And the fact is that this will not stop the harmful effects of mold or prevent mold from growing if there's underlying moisture problem in the building. So the cause of the moisture problem must be fixed to stop the mold growth. And so again, rentsafe.ca can provide you with a lot of information. There's publications, videos, events. There's a mold resource collection as well too that you can access. And I'll pass it back over to Erica.
Great. Thanks, Lynn. So just to briefly give you a sense of the CPCHE Child Care Checklist. So this is an online resource that we just relaunched a year or two ago. An earlier paper version is now a more interactive online resource. And it encourages best practices and for healthy and sustainable childcare environments. It provides a menu of options that go beyond the basic core regulatory requirements to support childcare professionals in incorporating protective measures and sustainability in their day-to-day practices and in their settings. So most of the tips are applicable to both center-based and home-based childcare settings. And we encourage childcare professionals to really make use of the checklist and the resource hub in the way that makes the most sense for you in your particular circumstance. We also want to stress that the items in the checklist do not replace or even duplicate public health guidance. It's really the things that go above and beyond what would be expected from a public health standpoint, a regulatory standpoint. And it's the responsibility, of course, for every childcare program to follow those licensing requirements and or other public health and safety requirements within their particular region or province or territory. So within the Child Care Checklist and Resource Hub, there's a Resource Hub that gives information on these 9 areas, and those 9 areas correspond to the things in the actual checklist tool, which is as a way to sort of go through and assess your progress in some of these areas. So the 9 topic areas include air quality, both indoors and out. Issues to think about in terms of outdoor learning and play areas, indoor learning and play areas, sun safety, things like sunscreen use and protecting against extreme heat, cleaning and disinfecting practices, kitchen and food prep, facility maintenance, things like using fossil fuel powered lawnmowers and leaf blowers and all of that kind of stuff, as well as office administration tips. sustainability and climate action, some of the things Lynn mentioned, like composting, recycling, those sorts of things, and some tips related to inclusivity, equity, and accessibility for all children. So if you were to click one of those 9 boxes, you would get to a page that looks like this. And this is the sort of menu of topic areas within that general theme. We're looking at the example of air quality. So you can see there's a few boxes related to outdoor air quality, such as understanding the Air Quality Health Index, which helps you to know, to tailor kids' outdoor activities according to whether there's wildfire smoke or other air quality concerns. And then a number of things like ventilation, the shoes off policy, so forth, that affect indoor air quality. If you were to then click one of those boxes, you would get to a sub-page. So we clicked the ventilation page, and here we are. There's a little paragraph that helps you to understand why it's important, a few bullets on what actions you can take, and then at the bottom, these are clickable links to some key resources from Health Canada and other authoritative sources, so that you can learn more about the issue and what can be done to protect children's health and the health of staff. The ideas and suggestions included in the checklist and the resource hub, range across those topic areas, and they really help to go above and beyond core requirements to create more sustainable and healthy indoor and outdoor environments for children. So as you move through the checklist, as I mentioned, you can click the links that will bring you back to the resource hub if you want to learn more and have a greater understanding of the tips that are listed in the checklist. You can complete the checklist all at once, or if you've provided your email address, which is an option, you're able to save it and return to it later on. So you can use it as a continuous improvement tool. So this checklist, we really built it for childcare professionals, but there's lots of ways you can do it. Sometimes people use it to sort of track progress over time as a way of having a conversation with client families, or in the case of a center-based facility with the board, for example. And also educators who do the checklist can also earn a professional development credit from the Canadian Childcare Federation. So in whatever way you may decide to use the checklist, we applaud your effort to go above and beyond to create healthy environments. So CPCHE and CCCF recognize that we are at a very important moment of opportunity in Canada to invest in childcare settings that will give children the best possible start on lifelong health and learning. So that's why we were really excited to launch a national vision statement together with nearly 50 other organizations from across Canada, urging action at all levels to ensure healthy and sustainable childcare settings for the benefit of all children in Canada. So across this 10-point vision, there's a focus on empowering and supporting the work that you all do in providing quality childcare for children and their families and communities across Canada. And we are now at the place where we're going to start getting you thinking about action, and I would like to hand it back over to Lynn.
So yeah, some of the things you can do in terms of moving to action, taking a first step, kind of looking at, maybe actually I'm thinking now you're probably listen to a bunch of different things. You're probably already thinking of something you might want to decide to do as a first step, or something to start off with. It might be as simple as what we were talking about with the canned tuna. It might be choosing light over white tuna. It might be leaving those shoes at the door and not letting the kids or yourselves come in with dirty boots and shoes and those sorts of things, and having all the chemicals tracking through the house. Thinking of terms of low, medium, high risk, it might be something as simple as not microwaving with plastics. And so you may want to, your spaghetti sauce, just put it on a glass plate, put a paper towel over it, and then just warm it up that way, and then let it cool. If the child has to eat in a bowl that's not glass, then you just let the food cool and put it in a bowl. So already you're looking at low, medium, high risk that way. Finding ways to engage kids. really, I have this cute story. Years back, we were at a First Nations community. We do a lot of workshop with our Caring for Mother Earth project with Anishinaabe Nation. And we had about 12 little kids just sitting around the laptop because we'd forgotten our projector. And we put the top 5 tips video on. And so afterwards we thought, oh my goodness, it's a little screen. I don't think the kids got anything out of it. And we just did a little quiz. We said to the kids, so did you hear anything or remember anything we said? Or what tip did you like the best? And the smallest little guy, who was 4 years old, just jumped up and down, and waving his hands and went, bust that dust. So that was really cute. So it's the video itself is a good way to engage kids. And again, you know, you can engage them as well in gardening or compost things. And really take time to celebrate those simple low cost actions that you do. A lot of people are actually, when we do workshop, are surprised by knowing they shouldn't microwave in plastics, or that even your fancier plastic containers are also not great to microwave in plastic. So, you know, even just like knowing that as well, and making that simple low cost action is something to celebrate if you decide to do that as well. You want to, you know, strive for continuous improvement, and the CPCHE checklist to plan for and track your progress is really a great way to do that. And if you're not sure, talk with your public health professional. They're always there to help if you have any questions. And now it's time for the participant poll, and I'll pass it over to Suzanne or Robin.
Hi, so I'm going to launch the poll. Now, fingers crossed this works, but I think it should. I practiced. So let's launch the first poll and see how we go. There we go. So it's, did you learn something new or surprising during this webinar? And the options are yes, no, or not sure. So if you could just take a moment and fill that out, that would be great. Oh, it says mine won't work. Oh, there we go. Now they're popping up. Okay. And also, if it's not working for you, you can always feel free to put it in the chat. I can catch it in the chat as well. Lots of yeses. That's a good thing. So that's looking good. Wonderful. Okay, so the next poll, and try launching it too, was, do you plan to make any changes using the tips and ideas shared during this webinar? So I'm going to launch this one. So those great tips that Lynn just put forward would be wonderful to try out tomorrow. Oh, yes. Lots of positives. Everyone's feeling very positive today. That's wonderful. Nice. And thanks, Lynn, for giving us such practical suggestions too. That was great, because those are things people could do right away. They don't even have to wait on those. Wonderful. We have another poll I'm going to launch as well. Which, if any, of the following actions are you likely to take? You can select more than one. So let's try this one and see if I can get this one going to you. And the options were not microwaving in plastic, opting for fresh or frozen instead of canned foods, choosing low mercury fish, avoiding foods in grease resistant packaging, and choosing organic foods when possible. That one was a bit of a thinker. I think people are thinking a little bit more about that one. The other ones were easier to answer. But I see a lot of people saying not microwaving in plastic, which is a really quite easy one to do when you think about it, and can make a big, big difference. Oh, a lot of people are saying all of them, which is great. That's what we want to hear.
That's awesome.
Yeah. That's great. All. Wow. You guys are amazing. That's wonderful to see. All right. Well, I think I will throw it back to you. Is it Lynn or is Erica? Erica, are you taking over now?
Yes.
All right. And we can go to some questions if you want, if that's what's next on the.
Yes. So now it's truly your turn, and I think I'm not familiar with this platform, but I am seeing some hands popping up there. So that's really good that we have some questions. So we can get started with those, and I think Robin or Suzanne, you know, you read them out because I'm not seeing them here. And so there's some that maybe I can help with, but we also have both Helen and Lynn who work in public health who can help us out with answering any questions that you may have.
Amazing. I did have one question that came up earlier that I wanted to make sure I didn't forget, so I wrote it down. Laura was asking about using vinegar as a disinfectant because she felt she had thought it didn't disinfect it didn't kill germs. So she's a bit concerned about using that as opposed to the bleach.
That is true. And actually, our mention of baking soda and vinegar was really in the context of just routine household cleaning, not to replace any proper sanitizing or disinfecting practices. But I want to pass it over to Helen because I know that came up in our conversation earlier today, Helen. So maybe you can just share a few more words about that topic.
Yeah, thanks for that question. And that's a really good insight. Exactly what Erica said. Certainly, baking soda and vinegar have been used for cleaning, but vinegar is not a disinfectant. And I'm sure you've heard this throughout COVID, but for any infection control, if there is an outbreak or illness in your family or in the home, public health would recommend that you use a disinfectant. But as Lynn mentioned, for routine household cleaning, that's what you're doing is cleaning. You're not disinfecting with vinegar.
Great. Yes, because that was the concern. Someone else said that they were cleaning with the vinegar and water, but then their agency, so who does their home visits, their supervisors came in and said that they wanted them cleaning with the bleach again. So that would make sense as per your comments.
So you're cleaning with soap and water or vinegar. You're disinfecting, if that's bleach or other compounds that you're using. Yeah.
Yes.
Helen,
and that. Go ahead.
Sorry, Helen, I wonder if you could explain about the bleach, because people sometimes think that you need like a lot of bleach when you're cleaning.
Yeah, so I don't have the calculation with me, but you can find that on the Public Health Ontario website or any health unit that you contact, how you would dilute it to the level that is acceptable for a disinfectant. But you're right, you don't need it everywhere and you don't need to use a large amount. If you are using bleach, just like with any other chemical, you have to make sure that you're following the instructions on the label, that you make sure that children aren't around when you're doing it. And, you know, those are toxic substances. They kill bacteria and viruses, so they need to be stored properly and labeled properly.
Right, good point. So someone asked what the ratio is, but as was mentioned, that stuff you could find online, and we will try and include some links with that with our follow-up message, so you could find that out that way as well. Someone's asking, is the plastic cover used to cover food in the microwave not safe? You know, the dome kind of covers that you get often so it doesn't splatter all over your microwave?
Helen, do you have an answer to that one, or Lynn?
I would say the major concern is food that's touching that plastic. So and because the food is what heats up. So it's the heat that is breaking down the plastic. So I would recommend, if you can, put a plate on top. It's better than putting plastic in the oven, but certainly it's not as risky as if the container itself is that plastic container.
Yeah, I would agree. I think that's sort of one of those like high, medium, low risk type situations. And I think the knowledge about how plastics get into, into the air, into food, into water is always rapidly evolving. So for example, even just washing plastic items or washing clothing, a lot of our clothing has synthetics, which are essentially plastics. all of that stuff is also going out into our wastewater and eventually into surface waters as well. So the more we can reduce the use of plastic in any way, helps to curb those ways that plastic gets into our environments and ultimately into our bodies. So, you know, we all have residue of those microplastics and tiny little plastic and the chemicals in plastics. We're all exposed and we all have them in our bodies, unfortunately, including children and babies. So I think that Helen is right, that it's really that contact, but I wouldn't rule out necessarily that some of the material from that plastic, when it's being heated up, could be released into the air inside the microwave and get to your food that way.
Yeah, and the other thing about plastics too is, well, I always like to say plastics like to have a party with the fat. So you throw spaghetti sauce in a sour cream container or margarine container, or just in any kind of plastic container. You've probably seen afterwards how there's like all this rim of chewed up plastic inside the container. I think, I'm not sure whether I mentioned that too in terms of even plastic with the tips. Any plastic that's cracked or is starting to get sticky or looks old or you know, that kind of stuff, you want to get rid of that as well.
Oh, good point. Yep. Interesting. Someone, Trisha, actually, who did the checklist, she has already done the online checklist. She mentioned that she hadn't really thought about the idling vehicles as her parents pull up. So now that's something she's discussed with them and been able to say, yeah, I appreciate you turn your car off, you know, before you drop your kids off, which is actually a really good idea. And that it's funny. It dawned on me the other day because one of my neighbors is a home childcare provider, and I noticed a lot of her parents leave their cars running on the street, and I thought, wait a minute, that's some idling, and I know better than that, but I haven't had the nerve to go mention it. But I might just do that now. I might feel so inspired. But it's true. It's the simple things like that. Like all those actions together really can amount to a lot. And it's something that we can all do each and every day within our practice. So it's a valuable thing. And that going through the checklist can give you some ideas of things like that, things that you could do that aren't that difficult really. But someone else is asking about which is the best place to buy craft materials which are safe for children, especially paint colors, Play-Dohs, etc. Well, I know you could actually make Play-Doh as well, because then you know exactly what's in it. You know, that's a great place to start. And making Play-Doh is quite easy and can be done really well with children. I guess you just really have to look at the ingredients. Like I think it was you, Lynn, that mentioned, or maybe it was Erica, when you look at the side of the labeling on things, you need to know what's in those materials that you're giving children to use, right? Whether they're playing with them or ingesting them or whatever they're doing with them, you need to really look at the list of ingredients, and the simpler, the shorter the list, the better. So that's probably a place to start with that. Oh, another message. Let me see. Okay, good. Oh, someone's asked about the checklist, and I did comment in the comments there. It is available on the CPCHE website, and we will be putting a link to that in the follow-up message as well. And someone's actually already included the link, which is really great. Thank you very much.
There's a question about steam cleaning too.
Oh,
is
throw that
steam
out there.
cleaning?
Sorry, I didn't see that one.
So is steam cleaning effective for disinfecting or for mold?
I want to pass that to Helen as well. In terms of mold, it's a form of moisture, so you may actually sort of contribute to the continued growth of the mold, but I want to pass that over to Helen for the question about disinfection and anything you want to add about mold.
Yeah, so with mold, I wouldn't recommend that. So to clean mold, soap and water is the best way to do that. But Health Canada recommends first, it might be a material where you have to remove the material itself. Like let's say you have drywall that has been wet for more than 48 hours. Very likely that mold has gotten into it, and you might have to remove part of that if it was in your basement and the bottom part of the drywall had been damaged or from flooding for a couple of days. But dry it as quickly as possible, but you want to reduce the humidity, not add more humidity to the room, and steam cleaning would be adding more moisture. And as a disinfectant, that would be another question I would ask your local public health inspector. So I think there are certain steam, like at the temperature, that could be a disinfectant, but I think it would be very specific to the application.
Okay. I don't, Suzanne, did you see any other additional questions? Maybe I missed something.
I see one question asking about thieves cleaner, and is that a good choice? And I'm not really familiar with that, but maybe.
Is that the brand?
No.
Is that a brand name or something? Or yeah, I'm not familiar with that either. Doesn't ring a bell. So we want to put something. If you want to put some more details in the chat, then maybe we could figure that out for you. But we're not really sure what that question was.
One of the things that I was just thinking about with respect to the question about steam cleaning is one of the things we learned through the survey is in response to COVID, childcare programs were trying lots of different things, of course, out of concern to protect the health of the kids and of staff for the spread of the virus. And unfortunately, some of the guidance coming out from Health Canada wasn't really reaching people on the ground effectively enough, at least as it looked from the survey. So people were using things like ozone generating devices, which are not recommended. Ozone is a very reactive gas that can be damaging to lungs. So it's not something that would be recommended to be used in a place where children or other people are present. As well as using sort of fogging devices that were intended to put disinfecting chemicals up into the air. This is also not recommended. This is not something that CPCHE recommends, just given that you don't really want, I mean, disinfectants, as Helen said, are toxic. They're meant to kill living things. So you don't want anybody to be inhaling that. So those are some of the things that we learned about well-intentioned practices to reduce disease transmission can actually cause harm. So as you know, as we've been mentioning, any doubt, reach out to your public health official. Even if you're not aligned with public health through your licensing, they're always there to help residents of the region with those sorts of questions. So, and also, of course, feel free to reach out to us as well if we can be helpful.
Okay, so there's one last one I'll throw out to you guys. It's and I know the answer to this, and that's why I'm going to ask you. So it's I know it from a long time ago from working with you guys. I heard that it's unadvisable to use antibacterial hand wash for children. What are your thoughts?
Yes, we discourage antibacterial hand soap for multiple reasons. One, the chemicals in there, they're essentially a form of a pesticide, right? So soap and water is just as effective. Usually the antibacterial hand soaps aren't even on the skin long enough to have the antibacterial effect. So in a way, it's a bit of a waste of money. So all public health authorities that I'm familiar with always say just regular old soap and water is best. And, you know, ditto for other forms of antibacterial products. There's a lot of marketing of antibacterial, and there are concerns about reducing the effectiveness of antibiotics as well. That's why some of the medical associations advise against using antibacterial products. Is it actually over time is making the drugs that we use to cure people less effective. And Helen and Lynn, if you have anything to add, please do.
When I think about some of them, like triclosan that was in the concern, Health Canada does assessments of these chemicals, and assessments are very complicated, but you know, they might say, well, they don't have enough evidence to say that they've observed human health impacts. But even if they observe environmental health impacts, in many cases, that's the endpoint that they've found. That's still an impact on human health. Like, we're connected with nature in every way. So anything, when you think about impacts to our waterways, to our groundwater, that's an impact to human health. So if these chemicals aren't needed, and they're not, like washing with soap and water and using the alcohol-based hand sanitizer has been what has been recommended in cases like COVID and outbreaks. But yeah, so not the antibacterial soaps.
Right. And one last question is about, could someone mention they're using a floor steamer just with water? Is that appropriate, or would that be non-advisable? with no chemicals in it, just using it with water.
So I'm assuming that that may be a hardwood floor and they're using that just to clean the floor. Yeah. So I don't see that, so it's not that you're putting a whole lot of water on the floor. Then I don't have a floor steamer, so I'm not really exactly sure how they operate. Maybe if I could just tell a very quick story too. Several years ago at many health departments were dealing with trying to respond to moldy school portables. And one of the issues that potentially might have been contributing to it, I mean, a lot of these weren't structured very properly either, but that we found out from some, when they were cleaning, they were maybe using way too much water and maybe pouring water on the floor to clean up quickly. Well, that water wasn't cleaned up quick enough, so the drywall in the bottom 6 inches of the floor in a lot of these portables got very moldy because of that cleaning practice. So if you're using steamers, as long as you're not leaving a lot of moisture on the floor and it's not impacting areas that can become moldy like drywall.
Great. Well, that's a very good point. And actually, I just bought a steamer and I did notice that it does leave the floor relatively dry, like a lot drier than it used to if I would mop it. So maybe that is a good idea for people doing home childcare who have to clean up sometimes some pretty bad messes and in a bit of a hurry. At least it might get that mess up better for them. So that's good to know. So very good tip. All right. Well, Suzanne, I'll throw it back over to you for conclusion and just you can remind people about what's coming next for them.
Yeah, thank you, Robin. And thank you very much, Erica, Lynn, and Helen. Great webinar tonight. Fantastic questions. Thank you for everyone for attending. I want to remind you, I know we're losing people quickly, you're going to be receiving 2 emails within a week of this webinar. One will be your professional development certificate and one will be a follow-up email. Give us 1 week to get this information out to you. And if you haven't received it in the week, at the end of the week, then you can email us and ask us, hey, where did it go? I didn't get mine. But before that, just wait patiently, please. And is there anything else, Robin?
That was great. Thanks so much for joining us, everyone. And thanks for bringing us all that great information. I'm sure this will inspire people to change their practice right away. So thanks so much for that.
Thanks, everyone.
Thank you.
Thank you.
Have a good evening.
Thank you.